Hi, my name's Claire Thomas. I am 1 month post-op from a anterior lumbar interbody fusion. I had my surgery a month ago with a great surgeon, Mr. Shard. He removed my L45 disc and replaced it with a synthetic disc and cage. It was quite major surgery, and I think I'd underestimated how major the surgery was and how slow the recovery was going to be. In the last week I've had a quite productive physio session. I had the use of an anti-gravity treadmill, which is a normal treadmill, but from the waist down you're encased in air, which pushes you up and reduces your body weight. So effectively you're walking on air. It feels very much like walking in the water, if any of you have done hydrotherapy. But it means that you can walk at a much faster pace and there's no impact on your lower back. It was tight and there was discomfort, but it wasn't painful like it is when I'm normally walking. So I did 4 miles an hour for 5 minutes, which I was quite impressed with. However, I always tend to push myself a little bit too far, and I was quite excited about the fact that I was walking and didn't want to stop. But I did pay the price, so for the next 48 hours there was quite a lot of increased pain levels in my back, in my hips, in my legs, even in my arms. Everything just hurt, my calves, but I suppose they're muscles I haven't really used for probably 18 months, so it's bound to be a bit of a shock to the system. But it just made me feel quite positive that I might actually walk at that pace again at some point. The physio even mentioned being able to run on these treadmills. My mind won't allow me to think about that at the moment, but walking is enough. Other than that, my scar, I've had a few problems with my scar. It's kind of ruptured at both ends ever so slightly. Apparently it's quite normal. The interior stitches are made of quite firm nylon, and sometimes when they're trying to dissolve they can poke back through the skin. So that's happened at either end of the scar where they do the knots. I'm about to show you the scar just to give you a warning if you're a bit squeamish, but it's not really anything ghastly to look at, it's just a little bit of redness. But the reason I want to show you it is because the scar itself actually looks fab. So here you go. There it is. You can see the redness at either end, and you can see it is quite a large scar, but actually for 4 weeks I think it's doing pretty well. If any of you have seen my previous post, you'll see how gruesome it looked, and I was horrified for the first few weeks, thinking it was never going to look any better, but it's really healing very quickly and I'm very pleased. So otherwise, pain levels are still really difficult at night time. Bedtimes, probably early to mid-evening, right through till 10 or 11 o'clock in the morning is difficult. I take my bedtime meds, but I wake up in the morning, I wake up a few times in the night. The greatest thing I found is ice. I'm using ice packs probably 5, 6, maybe 7 times a day, just for 20 minutes because that's the optimum time to use them for. But I never really believed in ice before, but I would advise anyone that's post-op or pre-op to invest in a couple of ice packs because they're amazing. Otherwise, I'm doing quite well emotionally. I have a few down moments now rather than down days, which I think is better. Maybe for an hour here or two I might get a bit tearful or down, but it's not a whole day. So things are looking up. I have my 6-week check on the 11th of August, so I will do a update then. Okay, thanks, bye.